Hello, my name is Francisco Rocio. I picked for my project, the disease I picked is diabetes mellitus type 2. The reason why I picked this disease is because it hits close to home. My dad is diagnosed with diabetes. My grandpa and uncle, who passed away, had diabetes. So it's kind of a disease that kind of runs in the family. So let me just give a little background about this disease. So there's two types of type 2 or diabetes, type 1 and type 2. Type 2 is the one I chose. Type 2 is an acquired disease based on different factors. Diabetes type 2 is when the blood sugar levels is higher than normal. This is two different factors. One factor is the pancreas doesn't make enough insulin and the glucose in the blood accumulates, or if the cells are not responding to the insulin, and also the cells don't use the glucose. So basically, insulin acts like a key for the cells to open up and let glucose, sugar, come in, and the cells use that glucose as energy for the body. So when insulin's not working, that key's not working, there's an accumulation of sugar in the blood, and then over time, the body starts having complications. People at risk are obese individuals, individuals who have history of diabetes in the family. Also, lack of exercise and poor nutrition can contribute to developing diabetes. It can be diagnosed by just having a blood test. There's a couple blood tests that I will mention later on in this presentation. The prognosis for diabetes is a successful one. If you just maintain the disease with medication and some lifestyle changes like exercising daily, taking your medication obviously, and just eating healthier options. The cause of disease and who's affected. And type 2 diabetes, age is another factor that contributes to developing. So anybody above 45 years of age is at risk of developing type 2. Obese individuals is the number one, and family history also play a role in developing the disease. Someone develops diabetes because the cells are not responding to the insulin produced by the pancreas, or the pancreas doesn't produce enough because there's a lot of glucose in the body that the pancreas can't keep up, and then over time it wears out, and then it doesn't make enough. That's also another contributing factor. This disease doesn't develop overnight. It develops over time, years usually. Pregnant women also can develop diabetes during their pregnancy. Part of the body that's affected and some of the symptoms that you may see with this disease. There's a lot of symptoms that could manifest from having this. One obvious is a condition called acanthosis nigricans, which basically is a brown spot or a smear that appears near the armpit, neck, or groin area. This symptom usually happens with obese individuals. Another symptom with this disease is eye complications. So if you have diabetes, you could be at risk for developing blindness, glaucoma, cataracts, and blindness. One noticeable indication that someone has diabetes is looking at their feet. In diabetic people, they develop calluses, foot ulcers. They may have poor circulation. They may feel numbness, and eventually lose feeling in the foot. In severe cases, they may just amputate the foot. So that's the number one indication in obese individuals or somebody that has diabetes for years, is just looking at their feet, and over time their feet cells, they start dying off, and then they develop gangrene, and in severe cases they have to have their foot amputated. How the disease is diagnosed and some of the treatments. The disease is diagnosed by having a blood test. So it tests your blood sugar levels. It tests the fasting glucose levels in your blood. So if it's under 99 milligrams per DL, that means it's in normal range. In pre-diabetic people, levels are between 110 to 125 mg/dls, and when you're diagnosed with diabetes, it's when your levels are above 126 milligrams per DL. Another test that they could do is called the A1C test. This test measures your fasting blood sugar, and this is actually a preferred method for diagnosing diabetes and monitoring any treatments that you may have. It tests the average blood glucose level for the previous 2 to 3 months. It's the most accurate, I feel. Also, if you want to have another test, it's more of a quick test, which is an oral glucose tolerance test. So basically, the person would drink about 8 ounces of glucose solution containing mostly 3 to 0.5 ounces of sugar in this solution. The individual needs to be fasting, and the blood would be drawn before the individual drinks, and then the blood also will be drawn after. So after, it's about 2 to 3 hours after the person finishes their solution, and then it has to be within 200 or below mg per DLs. The prognosis for diabetes is a successful one. Just if you just maintain your medications, take your medications daily, and if you change your lifestyles. For example, if you start having some physical activities, walking, jogging, biking, having healthier options, and then having monthly checkups to monitor your glucose levels, you could have a healthy life. But this disease develops over years. And my conclusion: diabetes is an acquired disease that can have severe consequences if not maintained. To diagnose this disease, you just take a blood test. Risk factors are obesity, family history, pregnancy. Treatments are medication, healthier diet, and exercise. And if you do all these, if you do develop diabetes, it's not the end of the world. You could live a healthy, long life if you just maintain or change your lifestyles. Thank you.